Okay, thank you for your introduction. Welcome, ladies and gentlemen. Uh, Thanks for being here to see my presentation. I'm Dr. Dang and I work in the Department of Neurology at Military Hospital 175. And what I'm going to present today is the effect of repetitive peripheral magnetic stimulation on patients with chronic pain or neck pain and back pain. So here's my team. The first people is my head of department, and and here is my college, and finally it's me. This picture is a review of our hospital, and let's talk about the numbers. In 2020, low back pain affected about 619 million people around the world, and it's estimated that the number of cases will increase to 843 million by 2050, and it's driven largely by population expansion and aging. So, low back pain is the single leading causes of disability worldwide, and the condition for which the greatest number of people that make benefit from the rehabilitation. So, low back pain can be experienced at any age, and most of the people experience at least one time in their life. So, the low back pain is one of most mature causes of disability worldwide, and it's a very common reason for the seeking for medical care. So the impact of chronic pain does not only involve the physical health, but it can also play a role in the mental health of patients. Chronic pain create depression, depressed mood, and activity impairment and sleep disturbance. So it to treat the ma- many pharmacology have to take to approach the treatment, but particularly chronic neuropathic pain have to usually require three or more drugs to combine treatment, and drug interaction and additional side effect will occur, and it also has some enormous economic impact to our patient. So the common treatment of low back pain is um, use medication and physiotherapy and physical therapy. Some people, some patient will need the invasive intervention. So, in the recent year, neuromodulation therapy such as magnetic stimulation, uh, the method is a new method that can penetrate to deeper cognitive structure with relative balance simulation and with the relative balance. So let me introduce about PMS. This the PMS is a repetitive peripheral magnetic stimulation. It's a non-invasive treatment method that can use for our patient, and the therapy offer a number of benefits and has produced great research for chronic pain. In Vietnam, uh, the patient who suffer from pain with have no specialized management. They always take medication such as non-steroidal anti-inflammatory drugs or corticosteroid and neuropathic pain drugs. Uh, and patients find it difficult to approach the magnetic stimulation to treat their pain because we are the developing country. There was only 3 or 4 machines in our country. So our purpose is define that whether the protocol that we choose for our patient uh, is effect for relief the pain, and they evaluate by the numeric pain rating scale. So in this study, we use the research design. It's a cross-sectional design, and our sample were collected in the Department of Neurology at 175 Military Hospital, and the inclusion criteria were the patient at NEA and with chronic pain treated with the RPMS over the course of 2 weeks, and we collected 20 individuals in total received 10 sessions. In addition, the patient were required to have a def- definitive diagnosis of chronic pain for more than 3 months. The exclusion criteria were any recognized lack of essential data such as diagnosis or pain score. And our procedure was we will explain to our patient for the RBMS, and then we place the patient in in the most comfortable and relaxed position. And over to the course of 2 weeks, uh, 20 individuals in total receive 10 sessions, and we using the Lim Yong H. ASEAN protocol in 2018. The numeric scale pain rating scale were assessed before and the first day and after 10 sessions. And then this is our technique. We use the round coil. It's vented for stimulating in a deep layer structure like a spinal root and covering a large area such as paraspinal muscle root. Stimulation sites were determined based on the most painful region of the patient. The coils were placed at the most painful lumbar region in the prone position. The stimulus intensive intensity level start at 20% and rise by 5%. The final stimulation intensity was determined at the maximum intensity level, which induced the sufficient contraction of the paraspinal muscle while still falling within the tolerable range of the patient. And here is our protocol. We choose from the study of Lim Young et al. In 2018. We use 10 sessions. It lasted 20 minutes, consists of 5 seconds of stimulation at a frequency about 20 Hz and followed by 25 seconds of resting. The total number is of stimulation 4,000 times. And next, here's the numeric band rating scale that we use for our study. Patient who suffer from pain with a severe pain will score 7 to 10, and the others will from 0 to 6. And here our research tell people about 60% of the before group BMS group experience moderate discomfort, whereas 16 people about 80 percent after in the group after RBMS reported that they have moderate pain, and in the severe pain group, there's have a decrease from 8 to 4 patients. And the most place that our patient feel the pain is the lumbar sacral, and we have 5 women in our study. The final result is that a variant of numeric pain rating scale. The result in the pre-RBMS group was 6.25, and the post RBMS group were 3.78. And the standard deviation, as we saw here, with the p value is smaller than 0.01, and the difference here. So so with the discussion, we want to show other study is similar to our study. With the Buyo et al. In 1998, they observed that the BMS reduced the pain severity by 99% in subacute musculoskeletal injury, and other study on chronic myofascial pain syndrome found that the pain relief lasts longer than the TENS. And Low et al. Demonstrate that the lumbar patient with lumbar spondylotic pain has decreased about 62 and 3%. And in other study, we found that the reduction is about 46% to 19%. It's similar to our study here. In our current investigation, pain level decline up by approximately 60% to 100%, depending on the type of pain diagnosis. The main difference between this study and other research was the various type of pain diagnosis chosen for the study, and the recurrent peripheral magnetic stimulation effect reduce chronic musculoskeletal and neuropathic pain is the most useful for our patient, and the protocol that we choose for our patient is very useful too. Let's talk about our limitation and the recommendation. The primary limitation of this research was its design: no randomization, no control group, and no blinding. And let's work to a few participants. Some data related to the quality of life improvement and patient satisfaction, long-term efficacy, and duration of the pain were also missing in our study. In addition, we need a randomized control trial should be conducted to investigate the protocol of the RBMS for the application to specific conditions. So to conclusion, um, I want to give you some short sentence about the peripheral magnetic stimulation because it's a rapid, it's give us a rapid and long-lasting pain relief and minimal adverse effect and for various type of pain. So thank you for listening for your listening.